What is local anesthetics? Local anesthetics produce anesthesia by inhibiting excitation of nerve endings or by blocking conduction in peripheral nerves. Two basic types of local anesthetics exist: the amino amides and the amino esters. Amino ester type include benzocaine, chloroprocaine, cocaine, and tetracaine. Amino amide type include bupivacaine, lidocaine, mepivacaine, prilocaine, and ropivacaine. Local anesthetics block neurotransmission via binding to voltage-gated sodium channels on inner portion of the channel along nerve fibers. Tertiary amine local anesthetics penetrate membrane in uncharged form, then bind to ion channels as charged form. Local anesthetics can be given with vasoconstrictors, usually epinephrine, to enhance block duration of action by decreased systemic absorption. Clinically, the order of loss of nerve function is as follows: pain, temperature, touch, pressure. Adverse effects of local anesthetics are central nervous system excitation, severe cardiovascular toxicity bupivacaine, hypertension, hypotension, arrhythmias cocaine, and methemoglobinemia benzocaine, prilocaine. A 10-year-old boy is brought to the emergency department due to a fall. Physical examination reveals a 2-centimeter laceration above the left eyebrow. Prior to laceration repair with suture, lidocaine is injected in the subcutaneous tissue around the laceration. The patient reports immediate relief of pain, and there is loss of sensation to touch in the area infiltrated with the medication. These effects are most likely due to blockade of sodium channels within the affected neurons. Lidocaine is a local anesthetic that interrupts nerve fiber transmission by blocking sodium channels in the neuronal cell membrane, preventing depolarization of the nerve. Local anesthetics have a greater effect on small myelinated nerves, so they preferentially inhibit neurons that carry pain and temperature sensation. Pressure sensation and motor function are often preserved at typical doses. Local anesthetics are weak bases that exist in charged and uncharged forms. When in the uncharged form, they diffuse through the cell membrane to block sodium channels from the inside of the cell. Increased acidity in the surrounding tissue, which occurs in infected wounds, results in more anesthetic molecules remaining in the charged form, rendering them unable to penetrate the cell membrane to exert an effect. Therefore, the dose required to achieve adequate anesthesia is higher in infected tissue. Blockade of potassium channels would inhibit repolarization, thereby prolonging action potentials and increasing neurotransmitter release at the neuromuscular junction rather than halting action potential propagation. Decreased calcium current slows the action potential propagation in cells that rely primarily on voltage-gated calcium channels for depolarization, such as cardiac slow response tissues, for example, sinoatrial and atrioventricular nodes. Peripheral nerve depolarization is driven primarily by sodium rather than calcium influx. GABA is the primary inhibitory neurotransmitter in the central nervous system. Activation of the GABA-A receptor, which is the target of some sedating medications, for example, benzodiazepines, activates voltage-gated chloride channels. The influx of chloride ions causes hyperpolarization, which inhibits action potentials. Interruption of axonal transport delays the delivery of organelles, for example, mitochondria and synaptic vesicles to the distal axon, causing impaired nerve impulse propagation. This occurs in some neurodegenerative diseases, for example, sporadic Alzheimer, or as an adverse effect of some chemotherapeutic agents, for example, vincristine. Local anesthetics diffuse through the neuronal cell membrane to block the influx of sodium into the cell. This prevents depolarization and inhibits action potential propagation.